In this video, we'll be going over some more ethical concepts: voluntary versus involuntary admission, patient bill of rights, and the nurse's role. I will be going over 5 questions. I will read the question to you, then I will pause a minute to let you think, then I will read the 4 options, and we will discuss how we got to the right answer. If you want more information on these topics, you can find them usually under the legal, ethical, leadership, foundations, and/or fundamentals areas of your nursing resources. Let's get started. Question number 1. A patient is voluntarily admitted to the psych unit. After being admitted, the patient states he wants to leave and is refusing ordered medication. He does not want to wait for the doctor to discharge him. What should the nurse do? Should you, number 1, restrain the patient? Number 2, call his wife and let her know he has decided to leave the unit. Number 3, have him sign a discharge against medical advice form or an AMA form and let him leave the unit. Number 4, put him in a locked unit. The answer is number 3. The key here is to know that he was voluntarily admitted. It doesn't matter what unit they're on. If they have come voluntarily, they have the right to leave. It's only the involuntary admissions where they feel the patient is a risk to themselves or they're going to harm somebody else, those patients aren't allowed to leave. So in this case, number 3 was correct. I just want to quickly also mention why number 2 is wrong. Please remember, like on a psych ward, you're not allowed to say whether somebody is there or not, and you're definitely not allowed to tell family members, friends, anybody if somebody's on the psych ward. We can't assume that his wife knows that. So it's a good idea to make sure you know the difference between voluntary and involuntary, and it is important if somebody does leave to get them to sign that AMA form. Number 2. A patient's son is at the front desk yelling that his mother is not receiving proper care and demands to see the nursing supervisor. What should the unit nurse do? Should you, number 1, notify the nursing supervisor as requested? Number 2, give the son a copy of the patient bill of rights? Number 3, explain HIPAA to the patient's son? Number 4, escort him to a quiet area and ask him to give more details? And the answer here is number 4. In the question, he's just saying his mother is not receiving proper care and is asking what we should do. And the first thing we should always do is to follow the nursing process and the clinical judgment model, which is to assess and gather more information. We don't exactly know what he's upset about or what's going on with his mother, so asking him to provide more details is what's appropriate before intervening. Leading us to number 4. So make sure whenever you're given situations, it doesn't matter where you are, what you're doing, always think, do I have the information I need before I can intervene? So always follow the nursing process, that clinical judgment model, and gather information before taking action. 3. A patient's son is at the front desk yelling that his mother is not receiving proper care and demands to see the nursing supervisor. He states his mother has not been washed up in 5 days. What should the unit nurse do? I definitely have a couple thoughts on this one. How about you guys? Would you, number 1, notify the nursing supervisor as requested? Number 2, give the son a copy of the patient bill of rights and ask him to report his concerns to the advocacy line? Number 3, explain HIPAA to the patient's son? Number 4, have security escort him off the unit? The answer here is number 2. So this question looks like it was a repeat of the last one. However, in this one, we now know why he's upset. So we have our assessment. And the answer here is to make sure he understands what the patient bill of rights covers and the kind of care his mother should be receiving. And therefore, number 2 is the best answer. I personally would like to see an answer that also asks the staff maybe if they know how often the client has been washed up, maybe the son hasn't been there when she's being washed up. So I would also want to find information out from the staff, but that answer is not there. So in this case, the patient bill of rights holds like the expectations that the family should know about and the patient should know about. And then, yes, if anybody's upset, there should always be an advocacy line that they can talk to or they can call if they do want to put into a complaint. I mean, sometimes that happens. Number 4, a nurse works on the night shift with a nursing assistant. The nursing assistant comes to the nurse stating that the other nurse working on the unit is not assessing a client with abdominal pain despite multiple requests. Which of the following actions by the nurse is best? Is it number 1, ask the other nurse if any assistance is needed and if the assessment has been done? Number 2, assess the client and let the other nurse know what should be done. Number 3, ask the client if he is satisfied with his care. Number 4, contact the nursing supervisor to address the situation. The answer here is number 4. What's important to catch in the question is that you are just another nurse working on the floor. You have your own assignment and you can't take the time out of what you're doing to go check on what the tech is saying or what the nursing assistant is saying. That's not your role. And as long as there's nothing unsafe going on, then you definitely don't need to take care of this. This should be a supervisor's role. And that's why number 4 is your answer here. So in this question, the key was to really make sure you notice who you are and who's talking to you, because sometimes depending on who they make you in the question changes how you're going to answer. Last question, number 5. A charge nurse is working on the night shift. The nursing assistant comes to the charge nurse stating that the other nurse working on the unit is not assessing a client with abdominal pain, despite multiple requests. Which of the following actions by the charge nurse is best? Is it number 1, ask the other nurse if any assistance is needed and if the assessment has been done? Number 2, assess the client and let the other nurse know what should be done? Number 3, ask the client if he is satisfied with his care. Number 4, contact the nursing supervisor to address the situation. In this case, the answer is number 1. The difference between the last question and this question is in the last question you are just a lateral nurse, and in this question it says you're the charge nurse. And therefore, what is best is we still need to assess. So don't forget, even if they put you in a leadership position, you still need to follow the nursing process, the clinical judgment model, gather your information. We need to know what's going on according to the nurse's perspective. So we just know what the nursing assistant told us. So therefore, number 1 is the answer. You are in a supervisory role at this point. And again, in order to get to that answer, the key was to notice who you are in the question. And just a little FYI, if you get questions that put you in leadership roles, especially on the NCLEX, those are higher levels because the NCLEX, remember, is for new grads with less than a year of experience. So the more leadership they give you, the better you're doing on the test. Hope you enjoyed this video on Ethics Part 2. There is going to be an Ethics Part 3. There's a lot of concepts in ethics that we want to get through. So if you enjoyed these questions and critically thinking with me, subscribe to our channel for more videos at Science Strategies, and you can always find us at sciencestrategies.com.